Good evening, good evening. September 24th. Well, we're going to talk a little bit today about Lyme disease. Lyme disease is one of those things that people kind of mention in passing. They don't really take it that seriously, unless somebody actually has figured out they have Lyme disease and they're taking the prudent steps. And a lot of that is because it's not really recognized. Insurance companies do not want to have to pay for Lyme disease. And if they kind of recognize it as a legitimate disease, then they kind of have to start paying for it. And so as long as they can run you through a bunch of other tests that make money for the medical industry and say it's not Lyme disease, they're going to do that, right? Until you go to your 10th specialist and finally get an honest answer. So Lyme disease is basically... The latest number is somewhere between 20 and 40 million people in the United States alone have undiagnosed cases of Lyme disease. So if you put that in perspective, it would basically be the biggest disease in the entire country, most prevalent disease in the entire country. And so you could see why these individuals don't really want to recognize it. But really good Lyme disease doctors are out there, and they are doing a very good job of getting people back to high function. A lot of times, I believe, unless you catch it in the first 30 days, you cannot fully get rid of it. But basically, you can get rid of a lot of the symptoms that it's causing, basically making it dormant in your body. So it's still there, but it's not affecting your everyday life as much. So let's go over side effects real quick. All right, so there's a good website. It's called LymeDisease.org. They'll send out newsletters if there's breaking anything, if there's new bills going through in the medical realm that might have breaking research or whatever it might be. They'll send you an email on it. So I signed up for the free newsletter. My wife and I believe that we have it. I've had a lot of these symptoms I'm getting ready to show. And interestingly enough, when we first moved into this house, which is 3.5 years ago now, I got sick 3 times in like 2 months, and they were just like this. So early Lyme, we got fatigue. 76% of people experience this. 70% experience headache. A little less than 70 experience some kind of rash. 60% fever, 60% sweats, 60% chills. Those all tend to kind of go together, right? 54% experience muscle pain, 48% joint pain, 46% neck pain, and 41% sleep issues. Now, move over to chronic Lyme, and you've got 80% fatigue, 70% joint pain. Said joint pain numbers jumped up a lot in chronic Lyme, which kind of shows the progression. Muscle pain, 70%. Other just, random pain, 66%. Sleep issues, 66%. Cognitive issues, 66%. Yeah, absolutely. So neurological issues with Lyme disease is a big deal, and it causes inflammation, and it causes inflammation in the spinal cord. At least it can. Certainly can cause it in the brain. And so a lot of people are believing that some of these kids that are getting diagnosed on the spectrum actually have Lyme disease, got it from their mother, right? So when they're born, it's an early disease. It gets worse and worse. So by the time they're 1, 2, 3 years old, this disease has progressed. In vast majority of cases, the kids aren't eating what they need to be eating. They're not getting the supplements and things that they need to help them out with this. A lot of herbal remedies that are necessary. Obviously, most kids don't get that. They get crappy food and Pop-Tarts, whatever. And so that just amplifies the side effects as well when you're not eating correctly. So then these kids get diagnosed, right? They've got neurological inflammation, have big issues with certain milestones, processing information, taking direction. Language can be affected, obviously. The weird sounds that kids on the spectrum make, which are associated with inflammation, sensitivity to different sounds, So certainly this is something that a lot of really high-end researchers in the private industry are looking into and finding some pretty astounding results, or findings, I should say, not results. Uh, Neuropathy, 61%, depression, 62%, heart-related issues, which my wife started to have, she's at, that's at 31, and then headaches is right in the middle at 50. So those are just some of the side effects. 74% of people reported at least one symptom as severe or very severe. So with me, mainly be cognitive. For sure, I do have, other than that, it's joint pain. I've been doing chiropractic work for a long time. Now, I haven't been doing work. I've been going to a chiropractor, getting chiropractic work done on me. 3 different chiropractors since I moved here. This latest guy is good. He runs a practice called Summit Chiropractic, and he's a family chiropractor, so you can take even newborns in, and then he'll take care of them. But I brought this up to him. I said, man, I think I might have Lyme disease. I was doing this test with nattokinase, and kind of seemed like I was having side effects after taking that natto for only 3 days that people with Lyme disease would take. And he said, oh yeah, you very well could. He said he thinks it's 30 or 40 million people that have undiagnosed cases. So basically 10% of the population in the United States, thereabouts, has Lyme disease and doesn't know about it, right? And it's adaptive. It's a smart bacteria. It's very bizarre. So I encourage everybody, if they're having issues, they know they've been bitten by a tick, or they live on a farm, live in the woods, or they live in the city but like to go to the woods, like people in Seattle. I mean, every freaking 3-day weekend, everybody heads to the Olympic Peninsula or up in the Cascades, right? They get away. And a lot of times these ticks are really small, like pinhead size, so you might not even know you ever had one. So important, I would get on this website. Again, that's lymedisease.org, and just read a little bit of it. Take a survey. They got surveys on here. They've got people's testimonials, their story, what they went through before they found out they had Lyme. So let's read a little bit more here. Get you guys a little bit more information. Many Lyme symptoms such as fatigue, cognitive impairment, joint pain, poor sleep, mood problems, muscle pain, and neurological presentations also occur in other diseases. Hence, the symptoms of Lyme disease significantly overlap those of chronic fatigue, fibromyalgia, rheumatoid arthritis, multiple sclerosis, Parkinson's disease, ALS, depression, and Alzheimer's. And many Lyme patients report being misdiagnosed with a different condition before being properly diagnosed with Lyme disease. And it's interesting. I don't think, so obviously just by reading that statement, you can tell that with the overlap that this disease has with many those other ones are accepted in the medical community, like readily accepted. They can't wait to accept those. So they're going to run through all those, and you're going to have, expensive test after expensive test done before they're like, well, maybe, or they might never say it's Lyme disease until you just get fed up with them not finding an answer and you go find it on your own, right? So where I was going with that is that didn't properly diagnosed with Lyme disease is that God, where was I going with that? I had a good thing going on in my mind, and I skipped right over it. But as you could see, obviously these are, fibromyalgia and Parkinson's, Alzheimer's, these are pretty serious, right? And a lot of people, just think if you've been told you have one of those and you don't, and so they're treating for those, and you've had continued issues going on, and you're not seeing any improvements, and maybe you're on like pretty crazy prescription medications that you should not be taking because they're not applicable, even though they're showing up as they should be. So now I remember what I was going to say. It seems like because Lyme disease can be transferred sexually, so basically the majority of the time, if your husband or wife has it, you both have it, right? Especially if you've had kids. Pretty much proof right there, right? So people don't tend to talk about that they haven't. So as soon as I didn't care. I didn't think it was like a big deal. You know, I was like sitting there and I'm like, man, I'm freaking tired, kind of mood swingy, a lot of brain fog. I'm having thoughts in my head that are like, pinpoint, amazing, fantastic thoughts, and then I'm trying to like speak them, and it's just like vomit falling out. Like I'm not pronouncing words correctly, and all this stuff that's happening with me. And so I bring it up to people, and since I started talking about it, and trying to figure out more information on the best way to figure out if you have it, finding herbal remedies and things like that, like people come out of the woodwork going, yeah, I had Lyme disease and blah blah blah, but they're really super hush hush about it. Like they haven't even really told. Like they'll honestly say to me like, yeah, I haven't really told anybody outside of my family, and they'll just start telling me about it. I guess because I'm so open about it. I don't feel like I've got HIV or something, like I need to hide it from people. If I don't even know if I have Lyme, but my point being, I don't think it's something to like be ashamed of if you got bit by a tick or a mosquito or something that had Lyme disease, right? I don't know. I guess the sexual component of it, if it, is possible to be transferred that way, which everything I've read says it is. Yeah, okay, I guess I could see why people would kind of go into hiding, but I'm married and I've got 2 kids, so whatever, I don't care. Let's see if there's any other little tidbits I could toss in here. CDC case Lyme disease symptoms. So we got migraines, arrhythmia, migraines, which is interesting because my lady that provides childcare, great woman, 5 kids. They're just now getting ready to graduate high school, and at least 3 of them already have, a couple more are getting ready to. And she's had migraines for a very, very long time, and her mom had migraines for as far as she could remember. So then they go, and it's genetic. I'm so sick and tired of the genetic horse manure that gets thrown around all over the time. Yes, genetics can help load a gun on a situation. They can. Okay? But the top researchers say it's realistically about 25% genetics, and then it's 70% what you're doing in your life, how you're eating, you're exercising, environmental toxins that you're exposing yourself to, all that stuff. So the vast majority of things that are genetic, and obviously I'm not talking about like Down syndrome and things like that, right? Those are, proof in the pudding sort of things. But we kind of toss the genetic thing at like everything, right? I'm fat because my dad was fat, or, we're big boned in our family. But my point just being is you could change a lot of what is considered your genetic weaknesses by changing your lifestyle and gaining more knowledge. Let's see what else is here. So that's, they have a thing called the Lyme Times. This is stories of people. Basically, you're just listening to people who have been members of this board, and people just like you and me who have really turned their life around because they found the answer, right? You hear some pretty crazy stuff here. My elementary take on this, because the science behind it I'm not super privy to, but apparently that there's 5 or 6 different bacteria. A couple of them are really intelligent. They'll attack a weak spot on your body. So a lot of these people had like maybe a back injury, doesn't have to be that significant, and they've had multiple surgeries and still are having the pain. And so they're having these surgeries to get rid of this pain, but it's really the bacteria. It kind of backs up to the bone in those weakened parts, and it hides from your immune system, which basically all Lyme does after it gets settled in. So that's why it's so important to catch it in that first like 30 days, they say. So it hides from your immune system, so those antibodies don't show up, which is why normal tests don't work. So if you went to the hospital and you took a Lyme or whatever doctor, and you're taking a traditional test for Lyme disease, if that's what they're looking for, you're almost never going to get a positive test. Only about 5 or 10% of people get a positive test, and that's because they're catching it in a stage where it's viable. if you've had Lyme disease for 3 years, the chances of you getting a test positive, even if you have it, is extraordinarily low. So that's really important to point that out, because people go and take tests like, oh, well, I don't have Lyme disease. No, you treat for Lyme disease. The doctors say you need to find a good specialist, and when you're about 50 to 60% better, your symptoms are vastly improving, and that's the point when the Lyme disease test will show up positive. And that is because you've done the proper protocols for your immune system to respond to the disease. Your immune system said, ah, there it is. It's been hiding from me this whole time. Now I can go fight it. And that's why you start seeing the improved symptoms, start feeling better, your immune system's kicking some butt, then the antibodies show up, and you can have a positive test at that point, and you know you're on the right track, right? So don't sit there and say, well, I went through this, protocol at my physician, and they say I don't have Lyme disease, because that doesn't necessarily mean anything. In most cases, actually, it doesn't mean anything. But it's a big deal, man. This is pretty broad. And if you figure like 1 in 10, anywhere from like 1 in 9 to 1 in, let's just lowball it a little bit and say 1 in 15 people in this country have Lyme disease, with, like 90% of those not being diagnosed, you have a lot of people who are suffering either majorly or minorly, being mixed diagnosis. This is a big deal. So don't treat it, as just something, that you heard. If you're suffering from some of these symptoms, especially if you're somebody who feels like there's something going on, there's something wrong, and the doctors keep telling you you're fine, do some more research, get knowledge. Knowledge is power, and power puts you in an ability to take action. And I just stress everybody does not kind of push it off to the side, and they really think about this and keep it as definite as a possibility. If you're experiencing these things, go to this website, check out the survey, check out the effects of both early and chronic, see if they match up with you. Read some of these people's stories on here. There's tons. You even got like a magazine section. Yeah, this Lyme Times is all these magazines, but tons of stuff on here. You're going to hear all different kinds of stories. And they got archive stories from way back, different resources of the top doctors in the field. They got Lyme treatment and guidelines, all different kinds of stuff, guys. So don't suffer, and don't depend on somebody else to find answers for you. Yes, these guys are going to find the answer, but you got to put in the work, right, to find a really qualified doctor who's then going to help you along that route. But don't just think that all doctors are the same, or the tests are the same, whatever. We should know better than that, right? We should know better than that. If you know something is wrong, it's up to you, in most cases, to find that answer or find the resources that allow somebody to help you. So I think that's it for today. This is taking this on the new phone, so hopefully the audio turns out pretty well. Picture looks phenomenal, even compared to my laptop, which is crappy. But yeah, I think that's it, guys. I'll catch you tomorrow. I'm going to redo that video that got lost on me the other day. It was a pretty decent video, actually. I actually had a pretty good agenda for that one, and then of course it disappeared. So but again, I'm attempting to show this on the screen so you guys can check it out. Let's get that up there. That is the website, lymedisease.org. All right, guys. Thanks. Appreciate it. Have a good night.